closer to the ear, and the submandibular or submaxillary gland was closer to the mandible, right? So here's the jawline right here. So we see this, I'm going to kind of outline it right here. Can you guys see that gland? Some of the glands are a little bit harder to decipher because of the fact that we use them for muscles and the glands sit on top of the muscles. So if you're not really sure about where these glands are on your cat or if they're still present, let me know. Just call me over and I'll let you know whether you have them present, and if you do, then I can point them out if you can't find them. So here's the mandibular or submaxillary, and here would be the parotid. So just remember, closer to the ear versus under the jaw. Alright, the last structure we can see in this region is the esophagus. To see the esophagus, you're literally just going to push the trachea to one side or the other. So if you were to just pick the trachea up, you'll see that there's a flat, kind of looks like a brown ribbon running underneath it, a thick ribbon. That's the esophagus. Obviously it's going to be collapsed. The esophagus stays collapsed unless there's food traveling through it. So it's going to be behind this. Another thing you can do if you are having trouble seeing it is you can actually just kind of pick up the trachea and bisect it, just cut it in half, and you can lift it one way or another and look underneath and see the esophagus underneath all. So, yeah, 2 ways. I don't have a view, unfortunately, of it, but it's pretty apparent once you lift this up that there's this big sheet underneath it. All right, now we're going to move on to the abdominal cavity. So just to orient you, here's the diaphragm. So here's the head of the cat. Here's the end of the cat. So we basically just scooted the view over. This is essentially what it would look like when we just opened it up. I'm going to take a moment and use this view to talk about some of the membranes. When you opened it up, I told you not to touch the big fatty membrane. That's the greater omentum. Okay? So now that we're getting into the dissection portion, we need to see what's underneath it. The best thing to do is just kind of gently pick it up, starting at the edges, and work your way over. It's going to be pretty embedded and tucked into those small intestines, so try to do your best to keep it intact, because as soon as you get a couple rips in here, it just wants to fall apart. Okay? And if it does fall apart, that's totally fine. It happens all the time. Do your best to keep it intact. If not, anything that comes out, just put it in the cat pits. Okay? You'll see that this is all going to gather on the stomach, and I'll point that out again on the next view, but I just want to show you the other things we can see externally. This whole big thing, the first organ that you'll see underneath the diaphragm, is the liver. Now if you look on the left-hand side of the cat, kind of near the liver, you're going to see that there's a structure that looks exactly like the liver, but it's not attached. That is the spleen. Okay? That's on page 13, but you do need to know that. The last thing that we can see in this view before we look to see what's underneath all the omentum is tucked right in here with the liver. What would that be? Gallbladder. I hear a few of you saying it, right? Gallbladder. So we have the gallbladder. It's going to be more on the bottom side, but you can see it sticking out anteriorly as well. So you'll be able to see it as, it kind of looks like a deflated balloon. It'll be either, usually it's green, like you see here, but because they actually stain the hepatic system yellow, you will sometimes see it with a yellow tint also. Alright? So this one's a pretty apparent gallbladder. Sometimes they're a little tucked away. So if you have trouble finding that also, just let me know and I can help you find that. Alright, so now let's get a different view. So we flip the cat around and the liver is being lifted up. So here you can see the stomach. The stomach is also going to be on the left-hand side. It's kind of tucked between or underneath the liver and next to the spleen. And as you can see here, see all this fat tissue attached to the larger crest of the stomach? All of that is the greater omentum. So you don't need to know that this is the larger crest, but it's helpful to note that. So basically in your C, you have the outside big C and the inside little c. The outside is where the greater omentum attaches. And then right here, in the center of the C, that fat that you'll see is the lesser omentum. It's tucked right in there. All right, so now for the part of the stomach. The very top, remember, that's the cardia. Then we have the fundus, which is kind of the top turn of the C. The main angle of the C, or like the back of the C, is the body. And then we draw the line right here. I think 4 right here is where they're saying that the pylorus is for, yeah, the pyloric stomach is. we draw the line a little bit further down. So right here, that's where the transition will be between the body and the pylorus. So this will be the pylorus right here. Just remember, it's the tip of the C. And then if you were to follow this, like this, you'd get into the small intestine. So you just kind of follow that and it wraps around. This is going to be really helpful to do because if we're going to be showing you the different segments of the small intestine, just like I explained, we'd be showing it to you with the body models. We're going to be showing it to you because it's going to be connected to the stomach. So we'll pull it out like this. Usually it kind of just juts deep, so you may have to do a little bit of digging, but it's not that bad. So dig out the duodenum, and again, we'd show it to you as being connected to the stomach. I'd say about 4 inches out. It's about as far as we'd go, okay, if we're calling it the duodenum. And then if you actually look in that first loop of the duodenum, right here where they have number 7, you'll see a meaty structure embedded in the membrane, and that meaty structure is the pancreas. So in order to find the pancreas, follow the stomach to the duodenum and look in the membrane. All right. Now I actually forgot to name the membrane. It's called the mesentery. That's the last structure on page 7 that you need to know. The mesentery is the membrane attached to all of the intestine that holds it to the back wall. So here you can see the intestine's been pulled out a little bit, and right in here you can see that there's like a net or a membrane, it looks like, attached to the small intestine. That is the membrane, or the mesentery. It's kind of fatty looking in this picture. Oftentimes, or not oftentimes, most times, with very few exceptions, you'll see it as just being a clear membrane with vessels running through it, okay? And I think we actually, oh, this one says mesentery, so yeah. So here's a different view. We're going to hop to this one more in a second, but you can see that there's this net attached to it there, and actually here you can see where their finger is on the other side, and you can see it pretty clearly. So it's just the net that holds the intestine together. Okay, so I'm going to finish my explanation of the small intestine now. So again, duodenum is going to be in view of the stomach, close to the stomach. If we're asking for the jejunum, we're not going to be showing you whether it's close to the stomach or the large intestine. We're just going to be pinning it just like that. If we want you to identify it as the ileum, we're going to be showing it to you as connected to the large intestine. Now, take a look now at the large intestine section. For what you need to know for the cacti section, you'll notice that there's an X for ascending colon that says if present. Most cats do not have an ascending colon, and I've even seen a few that don't even have a transverse. Their colon just doesn't take up as much space. I'm going to switch to the colon view, this last one. And I'm going to show you here, here's the colon, here's the small intestine. The large intestine is slightly larger, but not by much. And it doesn't have any house thread. So it does look very, very similar to the small intestine. All right? So note that that's the case. I'm going to show you a way to decipher this connection point in a second. But right here you can see the large intestine going into the small intestine right here. So just to finish up the small intestine, if we were going to ask you for the ileum, we would pin it here where it's clearly in view of where it connects to the colon. All right? Now the best way to identify this spot right here as where the small intestine goes into the big intestine, large intestine, I use correct terms, is because just like we saw in humans, it doesn't go straight into the end, and it doesn't have like a clean connection point. It goes in kind of to the side, right? So it would pop in right here, and it has this blind backwards pouch, the cecum. So you'll be able to tell that this setup here is the small intestine going to the large intestine because you have this awkward jump in the trail of things, so the line of things, and you'll see that cecum is the blind pouch that goes back. So now if we look at this large intestine, you'll see that if you look at this again, they're calling 5 the ascending colon. That's kind of a hard thing to decipher, right? Especially if it's not going to be perfectly in line in the cat's abdominal cavity. So if I were explaining this or showing this to you, I would call all of this the transverse colon, okay? Just because there's such a small part of that ascending colon that it's really not even worth mentioning. So I would just say all transverse colon. And then again, see it dropping down, this would be where it's the descending colon. Now the sigmoidal colon is going to be where it brings the colon back to the center. So really if you look right here, kind of the breaking line between the descending colon and the sigmoidal colon. And you can tell because there's that crease right there, and that crease is where it's going to start bringing it back to the body. They've kind of pulled this entire intestine a little to the right, so it doesn't exactly seem so clear, but just note that just like we saw in humans, the sigmoid colon is where it brings the colon back to the center of the body. That's the important thing to remember. Now for the rectum, you're going to identify, right? Okay, yeah, we just rectum. So you're going to identify the rectum because it's essentially going to be the portion of the large intestine that you see right before it goes into the lower, what did I say? Basically like the hip muscle wall. Okay, so you have that muscle of wall, the wall of muscle down at the bottom. Right before the large intestine leaves, we pin it right there. So the very, very end of it, essentially. Okay, and then the anus we pin externally, so we literally just pin the anus right next to the tail. Okay? And I don't have a view of that, but I'm sure you know where the anus is on the cat. Any questions for this? Great, so I'll pull a few of these pictures up so we can refer to them when you guys are doing your demos or looking at the cat.